Medical residents work in doctors' offices or hospital departments such as emergency departments, intensive care units, general patient wards and operating rooms. As a doctor in training, an office or hospital resident will develop their skills in giving examinations, laboratory work, ordering and interpreting diagnostic tests, performing medical procedures, recording medical histories, and mental and physical self-care. They will also gain experience in the disclosure of adverse events or delivering bad news. In hospitals, most of the residency medicine work and training will occur during rounds when a group of doctors and healthcare professionals go from patient to assess their condition, progress, and treatment. Alternatively, a resident may work in a doctor's office or outpatient clinic, assisting with patient examinations and treatments. Residents may also spend time helping coordinate services for patients alongside other healthcare team members. All resident doctors are required to complete medical school with a degree, such as a Doctor of Medicine. To enable residents to provide care during their residency, they must obtain a license from the jurisdiction or state where they work. Junior residents may have a restricted training license but will need to obtain a full, unrestricted license to continue their training or start their own medical practice. During their residency, a resident physician will continue their learning by gaining increasing responsibility while under the supervision of doctors or senior residents. Residents will also have the opportunity to work with patients long enough to observe how illnesses and conditions evolve. Residency or postgraduate training is a stage of graduate medical education. It refers to a qualified physician, one who holds the degree of MD, DO, MBBS/MBCHB, veterinarian, DVM/VMD, BVSC/BVMS, dentist, DDS or DMD, podiatrist, DPM, optometrist, OD, pharmacist, PharmD, or medical laboratory scientist, doctor of medical laboratory science, who practices medicine or surgery, veterinary medicine, dentistry, optometry, podiatry, clinical pharmacy, or clinical laboratory science, respectively, usually in a hospital or clinic, under the direct or indirect supervision of a senior medical clinician registered in that specialty such as an attending physician or consultant. The term residency is named as such due to resident physicians, resident doctors, of the 19th century residing at the dormitories of the hospital in which they received training. In many jurisdictions, successful completion of such training is a requirement in order to obtain an unrestricted license to practice medicine, and in particular a license to practice a chosen specialty. In the meantime, they practice on the license of their supervising physician. An individual engaged in such training may be referred to as a resident physician, house officer, registrar, or trainee depending on the jurisdiction. Residency training may be followed by fellowship or subspecialty training. Whereas medical school teaches physicians a broad range of medical knowledge, basic clinical skills, and supervised experience practicing medicine in a variety of fields, medical residency gives in-depth training within a specific branch of medicine. A resident physician is more commonly referred to as a resident, senior house officer, in Commonwealth countries, or alternatively, a senior resident medical officer or house officer. Residents have graduated from an accredited medical school and hold a medical degree, MD, DO, MBBS, MBCHB. Residents are, collectively, the house staff of a hospital. This term comes from the fact that resident physicians traditionally spend the majority of their training in-house, i.e., the hospital. The similar term residency is named as such due to resident physicians of the 19th century residing at the dormitories of the hospital in which they received training. Duration of residencies can range from 2 years to 7 years, depending upon the program and specialty. In the United States, the first year of residency is commonly called an internship, with those physicians being termed interns. Depending on the number of years a specialty requires, the term junior resident may refer to residents who have not completed half their residency. Senior residents are residents in their final year of residency, although this can vary. Some residency programs refer to residents in their final year as chief residents, typically in surgical branches, while others select one or various residents to add administrative duties to the normal learning in the last year of residency. Alternatively, a chief resident may describe a resident who has been selected to extend his or her residency by 1 year and organize the activities and training of the other residents, typically in internal medicine and pediatrics. If a physician finishes a residency and decides to further his or her education in a fellowship, they are referred to as a fellow. Physicians who have fully completed their training in a particular field are referred to as attending physicians, or consultants, in Commonwealth countries. However, the above nomenclature applies only in educational institutes in which the period of training is specified in advance. In privately owned, non-training hospitals, in certain countries, the above terminology may reflect the level of responsibility held by a physician rather than their level of education. Residency as an opportunity for advanced training in a medical or surgical specialty evolved in the late 19th century from brief and informal programs for extra training in a special area of interest. The first formal residency programs were established by William Osler and William Stewart Halstead VII at Johns Hopkins Hospital in Baltimore. Residencies elsewhere then became formalized and institutionalized for the principal specialties in the early 20th century. But even mid-century, residency was not seen as necessary for general practice and only a minority of primary care physicians participated. The expansion of medical residencies in the United States experienced a significant surge following World War II. In the post-war landscape, the demand for skilled physicians escalated, necessitating a robust training infrastructure. The GI Bill, a landmark piece of legislation, played a pivotal role in fueling this expansion by providing educational benefits to returning veterans, including those pursuing medical careers. The increased financial support facilitated a surge in medical school enrollments, spurring the need for expanded residency programs to accommodate the growing pool of aspiring physicians. This period witnessed the establishment of numerous new residency positions across various specialties. In 1940 there were approximately 6,000 residency positions available, but by 1970 the available spots had increased to more than 40,000. At the same time, the daily operation of the hospital increasingly relied on medical residents. By the end of the 20th century in North America, few new doctors went directly from medical school into independent, unsupervised medical practice, and more state and provincial governments began requiring 1 or more years of postgraduate training for medical licensure. Residencies are traditionally hospital-based, and in the middle of the 20th century, residents would often live, or reside, in hospital-supplied housing. Call, night duty in the hospital, was sometimes as frequent as every second or third night for up to 3 years. Pay was minimal beyond room, board, and laundry services. It was assumed that most young men and women training as physicians had few obligations outside of medical training at that stage of their careers. The first year of practical patient care-oriented training after medical school has long been termed internship. Even as late as the middle of the 20th century, most physicians went into primary care practice after a year of internship. Residencies were separate from internship, often served at different hospitals, and only a minority of physicians did residencies. In the United States, the Libby-Zion case, which led to the Libby-Zion law, garnered attention in 1984, shed light on the demanding work hours imposed on medical residents. Responding to this concern, the Association of American Medical Colleges released a position statement in 1988, recommending a cap of 80 work hours per week for residents. Subsequently, in 1989, New York became the first state to address this issue by implementing regulations through the Health Code, marking a pivotal moment in the regulation of resident hours. These regulations, integrated into the State Hospital Code, included duty hour limits and supervision enhancements advocated by the Bell Commission. However, despite the issuance of regulations, compliance was slow to materialize, and a decade later, site visits revealed widespread non-compliance with the established limits. The efforts to address and regulate resident work hours culminated nationally in 2003 when the ACME, Accreditation Council for Graduate Medical Education, mandated these limits across the United States. Medical residency is a period of supervised postgraduate training for medical school graduates to gain hands-on experience in a chosen specialty, such as internal medicine, surgery, or pediatrics. This is a full-time, intensive job that can last from 3 to 7 years, during which residents gain increasing autonomy while working under the guidance of experienced physicians. The goal of residency is to prepare residents to become competent, independent practitioners in their chosen field. What happens during residency? Hands-on training. Residents gain practical skills and knowledge through clinical work in hospitals or other healthcare settings. Supervision. They are closely supervised by attending physicians who provide feedback and guidance. Increasing responsibility. Residents gradually take on more responsibility for patient care as they become more skilled and knowledgeable. Specialization. The program is designed to help physicians specialize in a particular area of medicine. Program structure. Residency programs are structured and accredited to ensure quality and consistency in training. Key facts about residency. Duration. The length of a residency program varies depending on the specialty, but typically lasts between 3 and 7 years. Hours. It is a demanding job, requiring 60 to 80 hours per week. Aptitude. Residents are not able to practice medicine without supervision. Accreditation. The Accreditation Council for Graduate Medical Education, ACME, accredits residency programs to ensure they meet quality standards. A medical resident is a medical school graduate with a Doctor of Medicine, MD, degree who participates in a postgraduate training program accredited by the Accreditation Council for Graduate Medical Education, ACME. Medical residents work in hospitals or doctors' offices to continue their education and medical training in a specialized field. This is referred to as a residency. During their residency, a resident doctor provides direct patient care, including diagnosing, managing, and treating health conditions and injuries. Residency serves as a crucial phase in a physician's training, following the completion of medical school. It is a supervised clinical training period and an intensive, full-time job requiring 60 to 80 hours per week, which provides physicians, also referred to as residents or trainees, with hands-on experience and increasing autonomy in delivering health care under the guidance of experienced attending physicians. Residency programs vary in duration, ranging from 3 to 7 years, depending on the specialty pursued. These programs are accredited by the Accreditation Council for Graduate Medical Education, ACME, to ensure quality and consistency in training. Experts emphasize the importance of residency as a bridge between medical school and independent practice. During residency, residents gain a tailored, immersive learning experience where they apply their medical school knowledge to patient care, developing expertise in specific healthcare areas. They are trained to provide complex differential diagnoses, formulate treatment plans considering multiple organ systems, and interpret tests in the context of a patient's overall health. This comprehensive training prepares them to lead multidisciplinary healthcare teams effectively. The gradual transition from supervised to independent practice allows resident physicians to develop professionalism, confidence, clinical judgment, and autonomy in patient care, all essential attributes for successful practice in healthcare. Resident physicians can begin or continue prior work in research, medical education, quality improvement, administration, or other scholarly work, contributing to the advancement of medical knowledge and evidence-based practice. Resident doctors have various responsibilities in healthcare, which differ based on their specialty and the hospital they work in. They are often the first point of contact for patients and families and have a crucial role in overseeing and managing personalized medical care plans. This involves thorough assessments, creating treatment strategies, and closely monitoring patient progress to ensure that the best standard of care is provided. Senior residents also play a crucial role in supervising and collaborating with the healthcare team. They guide and oversee various healthcare professionals, from medical students to experienced nurses. By working closely, residents ensure that each patient receives timely and appropriate medical attention. This supervisory role is essential in maintaining the quality and effectiveness of healthcare delivery within their specific areas of expertise. In some instances, they also need to handle significant administrative work. This includes managing patient records with great care, ensuring that all medical histories, diagnoses, and treatment plans are accurately recorded and kept up to date. Additionally, residents are responsible for ordering necessary tests, procedures, and treatments, all while maintaining clear communication with their colleagues in the healthcare field. Their administrative skills are critical in ensuring patients receive the best possible care and that healthcare professionals can make informed decisions. Thank you for watching this video.